thank you very much for joining us on the fourth webinar organized by IIHMR University on this important subject of COVID-19 epidemic and update. And today we will be emphasizing on the preparations post lockdown if Government of India and state governments take a decision in that regard. Friends, as you know that India is one of those countries which started the lockdown in the very early phase of this epidemic. On 25th of March, we had about 600 cases when our Honorable Prime Minister announced a complete lockdown in the country for 21 days. Initially, we got very good response of the lockdown and the other containment activities that were undertaken by different state governments. And after week one, there was a significant decrease in the rate of growth of new cases. But in the subsequent week and days, for several regions, there is a slight change in the situation. The rate of decline reduced, and on day-to-day basis, we are reporting more cases, especially after 1st of April. Every day around 500 cases were reported. Only day before yesterday, we have reported more cases. And currently, the situation is that India has reported around 8,000 confirmed cases. In addition to this, yesterday, the Honorable Prime Minister of India had a video conferencing with all chief ministers of the states to seek their opinion and advice on what should be done after 14th April, when the first phase of lockdown completes. As you are all aware, that some state chief ministers have advised to continue with the lockdown, and in that process, some states like Odisha, Punjab, Maharashtra, Telangana, and West Bengal, chief ministers have already announced the continuation of the lockdown. So, SG sir, I'll request you to share with us how this epidemic is unfolding in India, and in this situation, firstly, what should be the way we should handle the lockdown? Should it be completely lifted or partially lifted, or some states are talking of lock-in rather than lockdown? So maybe you elaborate on that, and then we'll proceed with the usual question answers and the comments by our Honorable President of the Board, Pankaj ji.
Thank you, Dr. Mangal, for inviting me to speak on. I'll start with a very quick global review as well, how the pandemic has progressed, and then India and various states in India, and the lockdown.
Yes, sir.
So as of now, globally, as of today, by 3 p.m., the global count of cases has gone up to 1.79 million in the world. And the virus has spread to more than 200 countries. It has severely affected United States with more than 500,000 cases and over 20,000 deaths. The other countries in sequence of order are Italy, Spain, France, Germany. These are the countries which have the highest number of cases, and the death toll all over the world has reached or crossed over to 100,000 million deaths. It's a huge epidemic or pandemic, you can say, that the world is facing. The whole European Union is in the grip of this pandemic, and what effect it will have on the economy in coming days and few months is anybody's guess. We all know there are possibilities of going down into slowdown, economic slowdown, and adversely the GDP growth rate will be adversely affected all over the world. And I believe most of the effect will be more effect will be on developing countries like India on GDP growth rates. So that is a bit of a global scenario. The pandemic continues unabated, though efforts have been made. But coming to India, India is reaping the advantage of quickly swinging into action for prevention and control of pandemic of coronavirus. As soon as we learned on 30th January about the cases that occurred, 3 cases occurred in Kerala, the southernmost state of India, and this virus was imported from China. The medical students who had come from Wuhan, they brought this infection, and thereafter it is the history. And India is continuously, despite the fact that we strongly responded to the pandemic of coronavirus in India, and that is why we have much lesser number of the cases proportion to its population. As of today, I believe there are 8,356 confirmed positive cases, and 716 have recovered, and more than 270 deaths have been reported. I think the number has gone up to 290 or so. Interesting thing that we need to really see is that the death rates in the Western world is higher, and I believe it's significantly higher. This is 6.12% of the total positive confirmed cases, whereas in India it is around 3.45%. I guess that this is significantly lower than the Western countries. So this the benefit of early action, like, so India quickly went into lockdown after seeing that the surge of cases in the month of February and March, rather I would say in the month of March. So the government of India put in lockdown the whole country on 24th July night, midnight. And this is a lockdown for 21 days. One question is, has India done enough in controlling the pandemic, and what it has been doing in a specific, and what is the situation in various states in India? In India, it is Maharashtra, where the number of positive cases is nearing around 1,900 odd, and then it is Tamil Nadu, and then this is Rajasthan has come now in the picture. Especially, it has now about 900 or so cases now, The epidemic is continuously spreading. We are finding more and more positive cases now because of more testing. Now there are places which are hotbeds, the cities. These hotbed cities are Delhi, this is Mumbai, this is Indore, and I must say Jaipur. So today, after Mumbai, it is Jaipur which reported 96 new cases today. This is mainly because of intensive testing in the Ramganj area, which is most affected. This area has around a population of 6 lakhs. And first, we isolated the cases initially on symptomatology. Now we are doing kind of ring testing around the households of the affected cases. And we are finding more and more positive cases. Now, important thing to understand, all cases that are positive are not, all of them are not clinically apparent COVID cases. 60% and odd are either asymptomatic or say mild cases which are not reporting. And these can only be identified by doing testing. So India's response has been immense, very strong. And I say, as a country, India has really a great resilience to come together to fight such natural disasters. It has happened earlier, it is happening now. Whole India is one. So all the states are working very hard, following the guidelines given by the government of India, and the districts. Up till now, I think 400 odd districts have coronavirus infection. Some more, maybe this might have spread to more districts. We do not have information, but 2/3 of the districts in India have coronavirus. And the district response has been under the district administration, irrespective of which state is the key responder to the COVID. So wherever in the state like Rajasthan, which was a very cool and calm state up till now, has come into first 5 states in India, where most cases are being reported. But interestingly, if you see Mumbai, if you see Chennai, if you see Delhi, where most of the number of deaths is much higher as compared to Rajasthan. I think our listeners must know and analyze why the number of deaths in Rajasthan are low. The main reason is the quick isolation of the cases and admitting them in the hospital and separating them in isolated areas and effectively treating them. Though there is no treatment, but chloroquine is being used quite frequently in managing the cases of corona. Very important thing was the contacts of the cases in the family and the neighborhood and the friends who were coming to meet with these people. You know, we had in fact controlled the pandemic in India. It was very much under control. But two events which were not factored in measuring the spread of the disease or projecting the number of cases were one religious congregation that happened in Delhi, and thousands of people attended that congregation, and almost 30%, 40% of them were corona infected, And before lockdown, half of them had already gone to other places for preaching. But there were 2,300 who remained in their religious place. Later they were evacuated and tested, and a large number of them were found positive. Most of the states that we see, their number of cases increased by 30% in most cases, in most states. The other important thing that was not factored in with the lockdown on 24th July night was mass exodus of people from the cities to their hometowns in the villages and smaller towns where from they came in as laborers. And it was for next 2-3 days, it was a chaos, and it was beyond anybody's thinking what to do with these people. Now, in 3-4 days time, soon after lockdown, the situation has been brought under control, and those who walked out from or migrated from these cities, they have been now restricted. They have been now put in shelters. Arrangements for food and shelter has been made for them, and they are also treated like quarantine. So contact tracing of the affected cases, and then ring testing in the area of the affected cases. And then now Rajasthan is going for random sample of the tests. So that's what. So India has really massively responded to pandemic, and the result is India has low number of cases. Let us realize the number of cases is still increasing, and increasingly increasing, in the sense that every day the number of cases is increasing. This is something alarming. But think about it, had we not done lockdown, had we not responded to this epidemic, what would have been the situation in a country like India, which has a population of 1.35 billion? It would have been a wildfire, like people would have died like anything in this country. But the action from the government in the center as well as in the state has been able to contain the rate of growth of the epidemic in the country. Though the number of cases are still increasing every day, but yet I, as an epidemiologist, feel this is not a significant addition every day that is taking place in our country. So the question that I have raised myself is, it doing enough? The answer is yes. There's a massive response for containment of the spread of virus, isolation of the cases, and testing of people. You will be very amazed to know how many tests we have done in India. It's 1.87 lakhs. That is 187,000 tests have been done, and the capacity for test is also being increased. And now it is decided that we should go for random sampling in the population to measure or assess the community spread of virus. So the states are preparing for random sample testing, and they were waiting for rapid test. But I still recommend we can use our existing RT-PCR. We have enough test kits for RT-PCR, and random testing can be done using RT-PCR. So you will know the real situation of community spread. You might find more mild and asymptomatic cases positive for. So you should expect increase in the number of cases as a consequence of increased testing. That is one. Now the government of India has said what they have yet not come out with the strategy, but our minister had asked state governments to come up with the exit strategies in the post-lockdown era. How do we go about? So this lockdown will end on 14th of April after this initial 21 days lockdown announced on 24th July night. So the big question is being asked, will lockdown be totally lifted, or lockdown will be extended for say another 2-3 weeks, or there will be some combination of it, whether there will be a graded response, as I understand, that the areas where number of cases are high, I mean to say the districts where the number of cases of COVID are high, they will continue to be under total lockdown. The districts where the number of cases is low, then these are the districts which could be considered under partial lockdown. Partial lockdown means so the social distancing will continue, hand washing and other measures which were proposed, continued isolation, detection of cases and isolation of the cases, contact tracing, and testing for COVID will continue. The economic activities will be allowed on a smaller level at the initial stage. Is still like Delhi or Rajasthan or other cities. The laborers already who are within the state may be brought back to work. It's quite possible that the offices may be opened. As you might have heard that the government of India has asked their offices to be open from Monday. So that's a kind of graded response we might have, but definitely no public transport in the districts where the number of cases is low. Social distancing is so important. It's the most effective way of preventing spread of the coronavirus. And then there is a zone or districts which have not reported a case, or all the cases have recovered which were there, and no active corona positive cases. Now, will there be a total of lifting of lockdown? I'm not sure about. But this is what graded response could be for the lockdown, and maybe the government of India shall announce today or tomorrow what strategy they are going to have. All the Prime Minister of India had a video conference yesterday with the Prime Minister, with the Chief Ministers of the states, and they expressed their views and opinion about lockdown and what they think that whether the lockdown should be lifted or should it be continued or it should be graded, and what will be the strategy. The other important thing that is coming up is how to mitigate the effect of lockdown. Who are more affected? Those who migrated, those who are in the rural areas, all they know what to do with them for creating jobs or livelihood, and how to generate economic activities. That is most important issue now we have to face. So not only that we have to prevent the spread of corona, treat those who have the disease, but also think of how we can start economic activities and livelihood of the people. So I'll stop here for a while, and like that, Dr. Mangal, if you have any observations, then you can come forward.
Thank you, Dr. Gupta, for very comprehensive and elaborate description of the epidemic and the likelihood that how this epidemic is going to unfold in India, and also sharing with us your thoughts on how the government should take action on this lockdown, whether it will be partial lockdown or it will be phases, different ways, depending upon the epidemic situation in the respective state governments. Now, friends, so here we are in this midst of this epidemic in India, and surely the lockdown is not going to be lifted on 14th of April. Based on guidance of Government of India, the different state governments will take their own decisions, whether it will be partial upliftment of this or the continuation of the lockdown, because we need to continue and build on our efforts that has contained the cases to less than 10,000, despite the fact that we are almost 2.5 months in this epidemic. Now, as Dr. Gupta has summarized, that we need to not only continue with our containment actions and prevention measures in the form of lockdown and social distancing, and also use this opportunity, and we have used this opportunity for enhancing our capacity to treat and manage positive cases of the COVID-19. Now, we will come back on this issue of the management of epidemic in terms of its containment and in terms of responding to the positive people and take up your questions. But I would invite Dr. Pankaj Gupta to also share his thoughts on how best the state governments and different institutions, specifically the education institutions, can use this time positively and productively to continue whatever they are doing in their respective domains. So, Dr. Gupta, Dr. Pankaj, would you please elaborate on that? Sorry, sir, we are not getting your voice. Okay, so friends, meanwhile, our IT team will look into it, and I'll invite Dr. Gupta to further elaborate on the strategy in the context of the fact that in India, not all states are equally affected. One, not all districts are equally affected, as he mentioned. And if we look at the distribution of COVID cases, there are 12 states which have reported more than 200 cases till yesterday. And there are another 5 states who have reported cases between 50 to 200. And the remaining states either have only less than 10 cases or no cases. And within these states also, not that the entire state is affected by COVID-19, the disease is concentrated in some urban areas or in some cities of these states. So in this situation, I'll request Dr. Gupta. Dr. Gupta, are you listening to me? Would you like to?
Yes, sir.
I was saying that this disease, the spread in the country, is focal in nature. It is localized in urban areas, and within the states also. It's not that all the districts of that state are affected. So, will this fact, epidemiological fact, should guide the state governments in taking a decision on their strategy of uplifting or lifting this lockdown?
Dr. Mangal and friends who are still with us, I'd like to share two experiences of Rajasthan. One is Bhilwara and the other is Ram of Jaipur. So Bhilwara is now considered as the best model around the country. What they did is important. And for last 9 days, no cases reported. I think today one is reported. But a state which, a district which was contributing of the cases of the state of Rajasthan at a point of time is now not reporting any case. So the whole district administration and all they came in and measures taken by them. I'm not going to go into details. The next hotbed in Rajasthan is Ramganj, where, as I said earlier, the positive cases are clustered in the community. And there are so many asymptomatics. When we did ring testing, there were so many asymptomatics, and we are detecting more and more cases. And this is the area where people came from that religious congregation. And we were this in Jaipur and Vishwakarma area and all that. There are a lot of laborers who migrated or migrated in. So there was clustering of cases. So a focal approach has to be adopted to contain, and these two areas were under very, strict curfew action. So advanced action, what we call, is important in such. So I don't see they will be out of lockdown. So I said earlier, districts that have high number of cases will continue to be under lockdown. But the capital city like Jaipur, the whole city may not be kept under lockdown, because in the city itself, the disease is more confined to a particular area. But in last 2 days, we have seen cases in outer areas of Jaipur like C Scheme or Khol Nagoria and Shastrinagar. So there have been cases now outside the walled city. So, but these isolated cases can definitely be contained. That's what I believe. So this lockdown will be partial, or there are still 10 districts or 9 districts that have not reported a single case in Rajasthan. So, and that is a situation in many states, that some of the districts have not reported a single case. As I said, there are only 400 districts which have not, which have reported corona positives. The other 250 districts have not reported yet. So the response will be graded, as I said earlier, in lifting the lockdown.
Thank you, sir. So in this situation of whatever decision is taken at national level and respective state governments, either we are going to continue with the lockdown or it will be lifted partially. So
there are some states that have declared that they will continue to have lockdown, like Maharashtra, Punjab, Punjab,
Odisha, West Bengal to Telangana.
West Bengal, Telangana. These five states have already said that we will continue the lockdown for up to 30th of April.
That's right.
States are waiting for Prime Minister's call.
Ji, sir.
So
I was going to ask Dr. Pankaj Gupta that we will have to continue with the lockdown, either the way we have implemented it in these 21 days, or in some states it will be partially lifted. So, how the institution, especially education institutions, can use this time more productively and in a positive manner, so that we continue to observe the lockdown and also work towards using the goods that these institutions are expected to produce.
So can you hear me now?
Yeah, it is. Yes, we can hear you, sir.
Oh, very nice. Actually, the role of technology is really timely. Does and sometimes doesn't play. So anyway, thank you so much for this opportunity and very good evening to you and Ph.D. sir. You see that a decision will definitely be taken that whether and how many days the lockdown is going to be enhanced. And I believe that the journey which we have started, it has not to be left midway. And already we are having some good positive results, which the whole world is appreciating. Those all deals have to be consolidated. So on the side of the education institution, what our university and many other universities are doing, they are not engaging with the faculty more in the online mode. I believe that we have a group on the Skype and Zoom where we have discussions, we have got different kind of virtual groups being made, and also faculty members are now engaging the students on online modules and online engagements. And a lot of research groups also being created, which are having discussions, working paper series being created, a lot of publishable manuscripts are being created, and also the students who have gone for the training, some who have gone for the dissertation, their regular mentoring is happening over the online mode. So I believe in a period of time, all the universities who are forward looking or rather to be more of a writing on the wall, and you have to get yourself prepared for delivery in an online mode. And all the three streams, either teaching or training or all have to be enabled in that manner. And also the way you analyze and manage the performance of the faculty and staff, how you're going to create the performance measurement systems, how you're going to create your PRAs, KPIs, and other things, they all will have a very big impact. And not only in India, but all over the world. So there is more and more use of the artificial intelligence and technology-enabled platforms. And we already have a technique that where the classroom lectures and all are recorded, put on the server, which are used by the students over and over again. So I think more and more universities will be going in this direction. So I think some days back there was a vice chancellor's meeting. There also people discussed that one of the top three areas going to come up in future, and I think everybody voted public health or health management as going to be very top ranking area where more and more people will be contributing. In addition to other like liberal arts and the blockchain and artificial intelligence. So these are some of my comments, and about extending this lockdown. I would say that we should not be taking it more as a crisis, but as a great opportunity. Because in our normal thing, we are just running and running, but we don't have time to see that in what direction are we running. And so at these moments are giving us an opportunity to reflect and to fine tune our strategies. And also there are a lot of, like I know that there are companies who are using use of the CRM systems, that who are your very, very top customers and building relations, trying to find out their real requirements. So luck is like opportunity and preparation. So right now the opportunity may not be here, but that eventually it is going to come. But preparation is right now in your hand. So how you can think about innovation, how you can think about more innovative products, how you can build meaningful relations, how you can support your customers and suppliers. So all these things we can do that. And at a personal level, I will say that we should not go for loneliness, but more for the aloneness. Loneliness is more on a negative term where we really need to go to the malls and meeting people and this. And aloneness you can get by in the journey where you engage yourself in meaningful activities, including yoga, meditation, mindfulness, pranayama, and then you also see the bliss which is already within you. And for the health workers, my message is that you should be guided by the Seva mission, an expansion of the self And therefore, the government should also pay a lot of attention to their safety and do reward mechanism. And lastly, I'd like to say that especially when we think about Rajasthan, we see that our tourism sector is definitely going to be impacted for a long term, and also for our handicraft sector. So that will take a different kind of strategy. While you look at the mining industry and other heavy industries which are very part of this time, they will need different strategies. So we all have to be mindful to what we have to do and how we have to engage in this very challenging time. So therefore, we can convert this time into the preparation rather than thinking bad about it, because the maturity demands that if there is anything has to be accepted, it has to be accepted in a positive and graceful way. So therefore, the crisis will convert into an opportunity, and I is going to be that is illness that start with I will convert into wellness. Let us start with me. So these are my comments, and if there's any other thing, I'd be happy to share again. Thank you so much.
Thank you, Pankaj, for sharing your thoughts on how best to use this phase of lockdown in different situations. And as you have very rightly said, with the innovative thinking, the not only the same outputs could be maintained, but much more could be achieved in different situations. And especially thinking positive, taking this as an opportunity will show us the way how to maintain the productivity during this phase. Now, friends, this is the phase in our webinar where we will take up your questions specifically on the nature of this epidemic, the public health response on containment and prevention, personal protection, then management of those who have suffered from this disease, the clinical care, and also the other related issues of the impact of this epidemic on, say, economic activities or social issues, gender, issues of stigma, and other things. So we will go, you have sent some questions online. First we will take up those questions. My IT team to, yeah, please enlarge also these questions a little bit so that we can read. Yeah, I think this is better. And I'll request my fellow panelists to help me in responding to these questions. The first question is from Aditi, and she's concerned about the lockdown. In case of India, are spreading day by day, and so I need to know where are we lacking behind and what more precautions we all need to take. You mean containment of cases, Aditi? And if that is the question, so India has taken positive and right steps early on, as Dr. Gupta mentioned. Month of on 22nd March, we observed Janta curfew, and encouraged by the response of that, from midnight of 24th, we implemented this complete lockdown in the entire country, and this is coupled with all public health measures on containment and personal protection, and we have seen the impact of these measures. Only yesterday, our additional secretary, Ministry of Health and Family Welfare, shared some where he has emphasized that had we not taken these steps, we might have seen more than 8 lakh cases. And if we have not coupled the lockdown with containment measures, then we would have recorded about 2 lakh cases, while we were able to contain these numbers, and we are around only 8,000 cases as shared by Dr. Gupta. So I think we are on the right path. Only what is required is
Dr. Mangal, can I add to this?
Ji, sir. Sure.
So as you have said, we have taken all right steps and very timely. And the result is we have around 8 to 9,000 positive cases only. So Aditi, don't take it that we have not been able to check it. We have. But there are two things. One is statistical answer. There is something called as momentum of inertia. When you build up this case and spread of the virus, it's like, when you are driving at a speed of 100 kilometer per hour and you put your brakes, still your car drags for another kilometer. The same is with, though we have not yet reached, but we have started putting brakes, and it will take time to stop completely because this inertia will continue for some more time. But I am not denying the fact it is still on rise. There's no situation of momentum of inertia. So, but that will happen. So when the peak has, I believe, not reached yet. It will reach somewhere towards the end of April or beginning of May. So you must expect the increased number of cases and increased number of deaths. You have also asked that are we where we are lacking? Is there enough? I think this responsibility lies with the people. What is that? People should cooperate in the social distancing is like a social vaccine. So people must practice social distancing. Why police should come? Why people are asked to don't gather together, but still they do. So they are not behaving like responsible citizens. So the social distancing is very, very important. And I think all of us who are in this, everybody has responsibility to encourage social distancing. Practice hand washing is another important thing that has to be done. Don't come out of your homes unless it is absolutely required. You might have seen videos on TV that despite lockdown and curfew, even in curfew, people are coming into the streets, just roaming around. So I think this is more is social responsibility or social distancing. And so this is not the government, it is we who need to work on this. This is where we are lagging behind. I believe the social distancing is not more than 50% at this point of time. So unless we increase social distancing to 75% or 70%, you will continue to see a small surge in the cases over a period of time. Okay.
Thank you, sir. Thank you, sir, for elaborating on that. And I would also like to draw attention that when we implemented the lockdown or took the decision of lockdown on 24th of March, at that point of time, the growth of new cases was around 41%. And because of the lockdown, definitely the growth has come down to less than 20%. And it was even around 12-13%, except these couple of incidents. It is on slightly on rise. But as Dr. Gupta has emphasized, that the responsible behavior of people and their engagement and cooperation will make this curve flatten and provide us more time to prepare ourselves to deal with this epidemic. Now, moving on to the next question from MJ, that whether this period of lockdown will be extended. We have already discussed in this webinar that Honorable Prime Minister has discussed this issue with respective state chief ministers, and the decision will be taken soon, maybe today or tomorrow. But already some states have declared that they'll extend their lockdown till 30th of April. And Odisha is one of them. Other states are Punjab, Maharashtra, West Bengal, and Telangana. So we expect that in one or the other form, I think all states will extend it at least a minimum up to 30th of April. Next question is from L. Nandini, and her question is that there are reports now coming in saying that people tested negative may actually be positive, but couldn't be identified because of the average sensitivity of the test. What will happen in such situations? Okay, it's a very.
Can I respond to this question?
I was going to request you to respond to the implication of false positive and false negative test in a situation like this.
You see, this is a very technical question. What is the sensitivity and specificity of RT-PCR? Because we are using RT-PCR. Now, while we are not that much focused on positivity, so in single test, if the person is found positive, he is isolated as a case and treated, and then containment measures are taken to prevent the spread among the contact, and this contact tracing begins. But in case of a patient, a person becomes negative and he was in quarantine, then it is repeated. Though repeated, the second test has to be repeated. But I have heard there are 3 sequential tests on 3 different days before declaring it negative. So as you understand, when you do sequential testing of negative cases, what you are doing, you are increasing the specificity of your tests. So by doing second test on the negative, you are increasing the specificity of the test, and these false positives, false negatives will be ruled out. So, but it's not, you have raised the right question, but before declaring them negative, at least 2 or 3 tests are done at the interval of a day or 2 in all the false negatives.
Thank you, sir. Now, the next question is on the role of ICMR. And I think Rahil Jain has asked this question. ICMR is the highest technical body in India, which advises the Government of India and also the state governments on the technical issues related to health and medicine. And the ICMR has not only issued guidelines time to time, and also had undertaken studies to assess whether there is a community transmission in different situations. So I think ICMR is playing this technical role very, very effectively. And they have issued and modified guidelines on the treatment protocol as well as testing protocol. Can we move on to the next question? The next question is from Ankita. She has asked, what else could be done in epidemic like this beyond passive and active surveillance? Ankita, in any response to any epidemic disease, the surveillance is the key, and both active and passive surveillance plays very important role in early identification of the suspected cases, and then the system takes actions to confirm the cases and take containment measures. And that's what exactly we are doing in management of this epidemic. Now, the scope and extent of this passive and active surveillance could be enhanced or expanded in India, so that we do not miss out any case, and also the time between identification of the case and the response can also be reduced if our rapid response teams work efficiently. Next question is related to I would like to know, sir, in which stage of pandemic is India? Did we cross the stage 3? Now, this question is of academic interest. I would say that these stages of the epidemics are designed or described to understand that what should be the focus of containment activities. Stage 1 is related to the stage when the cases are only imported cases, and stage 2 is when the cases are focal in nature. And there was a lot of debate on this subject, where we are in India in terms of this pandemic here, whether we have reached to a stage 3 or not. And the stand of government of India is very clear that there is no evidence as on now that there is evidence of community transmission. We do have large focal outbreaks in different parts of the country, and in most of the cases we're still able to trace the source of the infection, and we haven't definitely reached to the stage beyond stage 3. And ICMR has also conducted a study, and that study also substantiate the stand of government of India on this. Next question is, what is the current status of new subject testing? Is there any data anywhere on this? I couldn't understand this question clearly. What is the current status of new subject testing, not total testing? Is there any data anywhere on this? You know, every day, all suspects, based on the protocol issued by ICMR on testing, our surveillance team identify the suspected cases, and as per the protocol, they are tested, and every day the new cases which are found positive on RT-PCR are reported by Government of India at its website, and you can look at that data of new cases there. And it also provides the state-wise data on new cases. And I think this is your question. Next is what would be your say on doorstep testing here in India? Would there be a spike of cases if we implement it? I think there are two questions, similar questions. Now, testing at the doorsteps, I do not know what you mean. Are you referring to the confirmatory test, PCR, or talking about this antibody test? I'm not aware of any decision on door-to-door testing, except in situations where in the hotspot areas, some state governments have shown interest in doing this antibody test, going house to house. Dr. Gupta can elaborate on this. So this antibody test in hotspot areas, is there any planning that it will be done of the entire population in that hotspot? SD sir, are you able to hear me? No. Okay, friends, I will take up this later, but I'm sure that only.
No, I think I should be on.
Ji, sir.
Can you hear me?
Delhi has taken a decision that in hotspot areas, they will go house to house test everybody. Or are you planning to do it in Ramganj area? I'm aware of the cluster testing in some areas.
Can you hear me, Dr. Mangal?
Ji, sir.
Yes, sir, we can hear.
We are able to hear you, sir.
Hello.
Ji, sir, we are able to hear you.
Okay, so this rapid testing is now recommended by the Indian Council of Medical Research.
Ji, sir.
It has been recommended to all states. In Rajasthan and other states, this rapid testing is being planned. So important thing is the procurement of rapid test kits, and which is already now on supply from Delhi to various states. So states are getting the rapid test kits. Next is whom we should do and what for we should do rapid testing. I think rapid testing is important to detect antibodies against virus, and maybe it is infection or it is the infection is over and we see antibodies. So this will be able, so let us not do this door to door, but do it on a random sample of the community or of the population, so that you can understand, you can assess the community spread of virus if it is any. This is number one. Number two, you can really look at the trends, community-based estimates of infection, and then you can make projections possibly. So this antibody test is very much there. We are recommending to the states, do it on random sample of the population. You can do it in the affected area. You can do it on the general population. The whole idea is to understand the community spread of and then the prevalence of infection. Because you might not know a frank clinical case, but if there is an asymptomatic case, it might have produced antibodies. So the flip side of this is herd immunity. So I am not one who would like to create herd immunity by creating more infection. But generally people talk about do this zero surveillance. This is called a zero surveillance we can do to test for herd immunity. So it is on the cards and it will be soon initiated.
Thank you, sir. Then we take up the next question, which is on he's saying or he's asking that in spite of such restrictions and lockdown, the number of cases are on rise in India. And I think Dr. S.D. Gupta in his opening remarks has very nicely explained that why we are finding or reporting more cases, especially in last couple of days. And the reason is very simple, that when we increase our surveillance activities and increase the testing, we report or we identify more cases. And perhaps this is this explains the increased number of cases that are being reported in last couple of days. And I'm sure now as these efforts and our surveillance is settled, we will start seeing the decline in number of cases on day basis. The next question is on whether the data on availability of PPEs and testing kits by facility is available in public domain. So Sumit, I'm not sure whether this data is available on public domain, but I would just like to share with you that Government of India has now procured more testing kits, and therefore they have revised their testing strategy, and more tests will be done. And there are adequate number of PPEs and other equipments are available in sufficient quantities in all states and all institutions.
Mangal Sahab, I have got a phone call from the Chief Minister's office for immediate video conferencing at 7:30. So I'll
sir.
have to.
Ji, sir. Ji, sir. So you want to leave this webinar, sir, now, or you are staying with us for another 5-10 minutes and then we can close?
I'm waiting for car, so long that is there, it comes, I'm here.
Yeah, it's okay. So thank you very much for that, sir, for sharing with us that you will be with the CM. We will take up these questions quickly and hope we will be able to manage this within time. What is the time now? It's okay. So 6:41. Let's take these questions quickly, sir. So what are the next steps to be taken by India to control coronavirus epidemic? Friends, first, we have taken the right steps. Only thing is that we need to implement them well. Also, the impact of these measures will depend on how the community engages itself with these efforts and how responsibly the individuals or the people behave during this epidemic period, and that will definitely give us good results in containing this epidemic. Next question is, sir, on have we stage of community transmission? I think we have already responded to this question, and let's go by the stand of the ministry, and let's not get carried away by the different messages that we get on social media. Next question is on the, sir, impact of this epidemic on financial sector. There are reports and comments by different bodies on the overall impact of this epidemic on the economy. Surely it is going to hit our economy, and that is one reason why there are so many consultations going on to take a decision on continuation of this lockdown. Maybe Pankaj, would you like to add anything on in response to this question?
So actually, the earlier report which are coming that this year was going to do very well, but somehow this setback is there. But I was talking to some of the economists yesterday, and the situation, if it is controlled in the next 2 months or 3 months, still we will be able to manage things. But still it is little premature to say at this stage, sir.
Thank you, sir. The other question is about the students, and I think Deepali wants to know that what will they going to follow protective measures, use of mask and use of sanitizers and maintaining distance after this pandemic is over, or after this lockdown is over. Deepali, the personal hygiene and the habit of washing is a good habit, and I think everybody should continue with these good habits that we are learning here. So the social distancing and use of hand washing are good habits. I'm not very sure whether we need to continue use of face mask or face covers after this epidemic is declared as contained in the country.
Sir, I'd like to add here.
Ji sir. Ji sir. Ji.
Saying that some of the habits are good, like you using of the hand sanitizer, maintaining distance, and like that. And face mask, we'll see, what situation is. And we are also going to go in a big way for the online way of learning. So these will be continued. Whatever are the new learning out of this whole experience, they will continue. And rest we'll see the situation, how the situation is. And we're already preparing ourselves to start the term 1 in the total online mode. So our faculty members are already working day and night to create all those modules in a total online manner. So the student need not worry. Your future is in a very secure hands. Thank you.
Thank you, sir. The other question is about the overcrowding in some areas, especially in slum where more people live in a small house or one room structures, and there is a scarcity of water and soap. And so, what could be done in such situations? This is a question from Siddharth. Siddharth, your question is a good question, and uh, there is no alternative to hand hygiene. And washing hands with soap and water is an important behavior that will check the further spread of this epidemic. And therefore, uh, I think we need to continue to promote it. Now, coming to your question about what uh, people can do if they are living in a crowded space, you know, they need to also observe the uh, practice of social distancing. And even if they're using common facilities in the community of curing water and also even the sanitary facilities, they can do it if they uh, use social distancing and use the whatever resources that they have at their disposal judiciously, and that's how they can overcome this specific situation of COVID-19. Will the finance sector of India suffer after COVID-19 situation? I think we have talked about briefly on this. Definitely, there are indications that it will have on impact on our GDP, and but people are also talking of uh, the V type of curve that, of course, on the immediate terms, there will be impact on the economic activities, but the recovery will also be uh, equally fast if we can manage this epidemic well. Uh, Next question is on what do you think in the context of recent religious gathering leading to an increase of cases? It is important to maintain an objective standards with which to hold religious leaders accountable for adverse community health outcomes. If not, what is the alternative? So this is true for any gathering for that matter. The people should have behaved responsibly uh, in the context of the epidemic like this, and especially when there were guidelines and indications from the leadership that uh, people should not gather in numbers. Initially, that number was restricted to 50, and later, under Epidemic Act, as this uh, Article 144 was applied, then the gathering was mm, not recommended of more than 20 people. Then later it was reduced to 5 people. And I fully agree with you that this type of incident should haven't occurred, but uh, we should learn from it. And in future, all congregations of people should be deferred, delayed until we have full control and contain this epidemic. Next, sir, usually the mortality rate associated with coronavirus is higher in elderly population or people with other comorbidities. However, in India, the maximum number of people affected by COVID-19 in India are in the age group of 20 to 40 years, as per the Union Health Ministry data. What could be the possible reasons for that? Now, Siddharth, again here, the data, first thing that you should understand is that we are in the initial phase of the epidemic. So drawing conclusions based on the data in an epidemic situation is not a good strategy. Now we need to wait till we have a full picture. But whatever this initial information that we have on the age distribution of infection, we find that in India, about 40% are reported in this age group, age bracket of 20 to 40. Uh, and also you might have noticed that no age group is immune, or they were not. It was all age groups were affected, and perhaps this is the most active age group, which moves out, go out of the house, and meet more people, and therefore they had reported more cases initially. And as you have rightly mentioned, world over, based on the data from different countries, this disease is more severe in elderly population and people with comorbidities, and hence this is the age group, and this is the group of people with comorbidities have shown higher death rates. Next question is, okay, this is about special courses on epidemiology for short duration or diploma courses. This is a question from our colleague from Himbarga. This is a very good suggestion, Him. I appreciate it. That considering the fact that public health and epidemiology is not recognized as a discipline in India, and there aren't many courses on epidemiology in this country, and therefore I think now all of us should think very seriously about this, that should offer courses on epidemiology for different durations, because different people will have different interests, and it's not only limited to public health professionals, but I think other people should also undergo a basic course on epidemiology, so that in future, if we face any incident like this, we are more prepared. Next question uh, is lockdown a solution to corona, or any other method can be used? Now, the containment measures for different diseases are different, and it depends on the mode of transmission of that particular disease. This corona disease is a viral disease, and it spreads through droplet infection. And here, the and especially in a situation when we do not have a vaccine, so it is important to follow the social distancing and personal behaviors of promoting hygiene and etiquettes, and also covering the mouth to break the chain of transmission of this type of infection. So in this type of infections, where the spread is through either airborne or through direct or indirect contact, I think this is the uh, methodology, or this is the approach to contain these epidemics. Next question is, community testing in districts with high number of cases and silent districts. It needs to be done. And I think Dr. S.D. Gupta has already elaborated on this question, that now since we have antibody test kits available, the state governments will take decisions on how they use this measure in understanding the nature of the epidemic in their respective areas. Okay, next question is the course on mental health and balancing. This is again Himbarga. Himbarga, you are very right in pointing out these areas. I think we do need courses on these related areas, because there are anxieties because of this type of epidemic in this country, and especially coupled with lockdown, and people do not understand what to do. I think this is an important area. Pankaj, would you like to add something to this?
Situation is good insight, and
Question
also,
24.
yeah, I saw this. Also, there is some very leading university from UK, and they also have been talking to me on some research work on the mental health. I believe that there is a need for a separate school for the mental health and well-being, because there is now a big demand for the professionals who understand mental health and who are also taking a lot of proactive steps for the overall well-being. We will discuss this in the faculty meeting and then with the academic council, and we'll see to launch these kind of maybe short-term courses or online courses the earliest.
Thank you, sir. Now, the next question is on again on the testing, and Dr. S.D. Gupta has explained the testing strategies recommended by ICMR, and different state governments are taking appropriate actions based on the epidemic situation in their respective states. So next question is about the possibility of second wave in India again. Also, should we expect this pandemic to prove a major catalyst in revamping the health sector in general and epidemic preparedness in particular, so far as the India is concerned? It's a very good question, and my response is that in an epidemic like this, the second waves are possible, and that depends on how the first phase of the epidemic unfolds and what type of containment measures are available and practiced. Now, in this particular situation of COVID-19, as we do not have any vaccine as yet, and we are only depending upon the surveillance, early detection, isolation, and quarantine of the healthy contacts, and social distancing as a social vaccine, as Dr. Gupta mentioned. So it is possible that after this first wave of cases subsides and reach to containment levels, we might get some small peaks in different parts of the country as second wave. But I think that's not a cause of big worry. We will be able to address that also, because now we have learned enough to address the issue of COVID-19 pandemic or epidemic in India. The second part of your question is very good and very important, that we should learn from each experience. And this experience tells us that how or what we can do to be better prepared in future in responding to epidemic of this nature. And also we can relook at the structure of our health systems and the type of skill mix that are required. I think the important fact that remains that the public health and the epidemiology needs to be strengthened at state level and at district level. And I'm very sure that all those who are responsible at national level and state levels, they will take a note of it. And immediately after this epidemic, or even during this epidemic, parallelly, they will look into this important aspect and take necessary steps to strengthen the public health and epidemiology capacity in India. Next question is, sir, suggestion for government to break the contact spread by facilitating contact and touchless entry by implementing RFIDs and other various such technologies. I think this epidemic will leave us wiser, and we will be able to use the technology more and more effectively. And therefore, first of all, we can plan our delivery of our services, especially in both in public sector and private sector, where there is no need for individual persons to visit the offices. And wherever it is absolutely essential, then the touchless technologies could be resorted more and more. It's a very good suggestion. And I think, and I'm sure that this epidemic will teach us these lessons, and we will adopt new ways of greeting each other, and also using touchless technologies more and more. Next, sir, next question is about the current crisis worries you the most. What gives you the most hope? Okay, it is our colleague from Delhi, Shankar Das. This is also a very important question, sir. I think Dr. Pankaj Gupta would be in a better position to respond to it. What worries most, and what is the hope? You know, I would just like to say, Shankarji, that in the situations of crisis, we quickly come together and address the issue as one. And we leave aside all our political, social differences. And that's the strength of Indian community. And this incident of COVID-19 epidemic is going to teach us a very important lesson, that we need to strengthen our public health and epidemiology capacities in this country, and we need to be better prepared for addressing the epidemic of newly emerging diseases in the country. And this will require redefining our health systems and restructuring the way we deliver health services, both in public sector as well as in private sector. Maybe Pankaj, would you like to add something here?
So I think the most important part you already mentioned, but I will again say that like the way during war or the cricket, the whole India gets united and they forget that which religion they are and which faith they follow. They are just one. So that kind of feeling is needed at this moment, where the common enemy has to be taken as Corona and we have to defeat Corona together. And secondly, because of social economic conditions and how the many people are living in small rooms and those kind of conditions, and also the people who live in the rural areas who are already very much away from the basic needs of sanitation and all that. That is my biggest worry, and that these are handled well. And also, many of our communications material are not used in a very targeted way, because the targeted way is using in their language and their dialect, and that's a very focused communication. Like if you go to a village which speaks in Marwari and their village sarpanch speak in that way, and also not focusing just on the negative side of Corona, that, but also the success stories, that how people have become successful out of this Corona and how they've defeated Corona. So I believe that the basic communication, how it has to be improved, and how the general public has to be involved in this way. And in different, the kind of the diversity of people, the different kind of opinion people have, and this unity should not bother our efforts. So that is my worry, and at the same time, the basic belief in the people of India that they will come up and they will stand united. And we have seen by the two calls of the Prime Minister that how the whole country came up and acknowledged the health workers, or sort of mini Diwali was celebrated and all that. So at the same time, I'm quite hopeful as well. Thank you.
Thank you, sir. Now, next question is from Dhirendra, and he has two questions. One question is about Bhilwara strategy, and he has asked why it is not so effective in Jaipur. Dhirendra, as you are aware that Jaipur, most of the cases are confined to a one locality within the walled city, and the social construct of that locality is totally different from Bhilwara, and so this is one reason, and perhaps the devil lies in the details. The way the Bhilwara approach was implemented in Bhilwara and the way it was implemented in Jaipur, that might explain the difference in the impact of the same strategy. Now, the state government has improved the implementation in Jaipur also, and therefore we are expecting that soon we will see the results in Jaipur also of the strategy. And your next question is about the impact of the ambient rising temperature on occurrence of new cases. You know, Dhirenji, we have discussed this earlier also. There are conflicting or different opinions on the effect of temperature on this occurrence of COVID-19 cases. There are reports which says that the epidemic had more severe form in those countries where the ambient temperatures were in the range of 10 to 15 degrees, while in other areas with more temperature, this is milder. But on the contrary, people have argued that in other countries where the temperatures are usually higher, the disease is spreading, like they give the example of Saudi Arabia. So WHO's stand on this is also is that there is this ambient temperature will not determine the course of this epidemic. So let us wait till we learn more about this disease and see that how the rising temperatures will influence the unfolding of this epidemic in India, because soon we are going to touch temperatures beyond 35 degrees centigrades, and even the temperatures will reach to 40 and 45. The next is question of it appears that the lockdown in certain districts is not complete. Some offices are open, some shops are open. Can government is asked to stop all activities which comparatively less essential and ensure 100% lockdown for the next 14 days? Suresh, I think with the uh, announcement of complete lockdown nationwide, the lockdown must have been complete everywhere. There was no relaxation in the lockdown. Although people didn't appreciate the importance of the lockdown and did not follow the advices or instructions issued, and that had that definitely may had adverse influence or impact on the way the new cases have been reported in those areas. And I'm sure if government takes a decision to extend the lockdown will be implemented in full spirit and very strictly, and should be implemented strictly. Otherwise, it does not serve the purpose of ensuring social distancing. The next question is, sir, is the same. We have already responded. The next question is about, is it possible this is reported to date are due to limited testing being carried out? When testing frequencies increase, we will have more cases. Yeah, Ajay, you have raised important question. Now, the number of cases reported are based on the positive test results, and therefore they will definitely be in proportion to the cases. But if you look at very carefully at the strategy of Government of India and the protocol, that makes a lot of sense to me as an epidemiologist, because the guidelines suggest that all suspects are prioritized for testing. And this was done initially based on the feasibility and the availability of the testing kits. But if you look at the test results, positive test results, even in those suspects, that means those who were high risk people of positivity, the rate of the positivity ranges between 3 to 4%. So if we do more tests in other people, the positivity rate will be lower than this. But definitely those cases who are missed due to this low number of tests performed and due to this protocol of the tests that are prescribed by ICMR, definitely some more cases will be identified, and definitely those cases will be either asymptomatic cases or milder cases. So my response is this, that as we get more test kits and we will do more tests and we will see that what happens. And definitely I agree with your conjecture that if we do more tests per million population, the number of cases reported will be more. I think this is all. We have covered all the questions that were raised today. Very interesting questions asked by our audience, and therefore we had to extend our webinar beyond the planned time of 1 hour. So thank you very much for being with us, and I would also like to thank Dr. Gupta, both Guptas, Dr. S.D. Gupta and Dr. Pankaj Gupta, for very comprehensively sharing with us their thoughts on the epidemic, COVID-19 epidemic in India and its consequences. So friends, see you again next week, and we will have another opportunity to discuss on your concerns. Thank you very much.
Sure. Mangal sir, thank you so much for this great enlightening webinar. So thank you, thanks a lot to you as well as to SD sir as well. So we shall be maintaining our webinar series, and I'm happy to inform you that the next webinar will be happening on the coming Saturday, and that will be led by our board member, Dr. Sudarshan Jain. And also other two experts will be also from the industry who have been associated with IIHMR. So I just thought to inform the people who are already part of this webinar, and that will be more focused on what industry is doing, how the problem in supply chain are happening, how to handle those things. And after that, we have another plan to have another webinar where I'll be requesting my colleague from Delhi, Sankar Das, and also colleague from Bangalore, Professor Usha. So that also webinar will be the next webinar. And in between, we will keep you updated. So my heartfelt thanks once again to you, Mangalji, and to the FD sir. Thank you very much.